Now, children have been largely spared from the worst impacts of the COVID-19 so far, but now children around the world infected by coronavirus are said to be developing some new symptoms of a rare inflammatory disease. And this signals a new pandemic risk for children around the world. Now, 3 children in New York have died from a certain inflammatory illness that is being linked to COVID-19. Now, all of these children had tested positive for COVID-19 or had antibodies against it. Health officials are also investigating 73 similar cases that have been reported across New York. And these children have exhibited symptoms similar to what is being described as the Kawasaki disease when infected with COVID-19.
Toddler, elementary school children are presenting symptoms similar to Kawasaki disease or toxic shock-like syndrome. Now, these are children who come in who don't present the symptoms that we normally are familiar with COVID. It's not a respiratory illness. They're not in respiratory distress. And I think that's one of the reasons why this may be getting discovered this far into the process. It's more an inflammation of the blood vessels, which can then cause problems with their heart. And there are 73 cases that the Department of Health, Dr. Zucker, is now studying. But the illness has taken the lives of 3 young New Yorkers.
The symptoms developed are similar to the Kawasaki disease or the toxic shock syndrome. Kawasaki disease is a mysterious illness that primarily affects children up to the age of 5. It causes the walls of arteries to become inflamed, resulting in fever and joint pain. Though frightening, most recover without any serious issues from the Kawasaki disease, but with this new illness, some critically affected children are ending up in intensive care units such as like shock-like symptoms. So how is this illness linked to COVID-19 similar to Kawasaki disease? Now, some of the symptoms of both the diseases reportedly overlap in children. But the mysterious illness in COVID-19 patients causes some severe abdominal pain, nausea and vomiting than the Kawasaki disease. The Kawasaki disease also majorly impacts heart vessels. But in the COVID-19 associated illness, only a few cases describe any kind of vessel inflammation. Now, the age of children affected by this mysterious illness is also not typical of the Kawasaki disease. Many children infected with this illness are above the age of 5. Now, as more and more children show symptoms of this illness, this also highlights the need for patients and health experts around the world to be vigilant. Scientists are still trying to determine whether this mysterious disease is linked with the coronavirus alone. And this comes as some children who have this illness have not even tested positive for COVID-19.